Well, the newest health scare seems to have moved to monkeypox, and you are not going to believe what they want to try to force you to take now. Today, we are going to discuss exactly what monkeypox is. We're also going to consider the risk, modes of transmission, and its prognosis. We're also going to compare monkeypox to smallpox because that is what they want to inject you with. So let's take a look at this. But first, if you enjoy my videos, share, like, and subscribe to the channel. There's a link to my store in the description, and if you'd like to support my channel with a super thanks, the button is under the video, and I am always so grateful. Okay, so let's take a look at this next pandemic, and guess who's involved? You got it. Your favorite evil villain, Anthony Fauci. Monkeypox is a rare disease caused by the monkeypox virus, which is related to the smallpox virus. That's important, so keep it in mind. Monkeypox usually starts with flu-like symptoms such as fever, headache, muscle aches, and swollen lymph nodes. A few days after these symptoms begin, a rash develops, often starting on the face and then spreading to other parts of the body. The rash goes through different stages, starting as flat spots, then turning into raised bumps, blisters, and finally scabs. Monkeypox usually runs its course and can resolve on its own without the need for specific antiviral treatment. Most people recover within 2 to 4 weeks. The body's immune system fights off the infection, and supportive care can help manage symptoms during this time. While monkeypox can be uncomfortable and sometimes serious, particularly for individuals with weakened immune systems or underlying health conditions, most cases are mild, and the disease resolves without causing long-term health issues. In the United States, the mortality rate for monkeypox has been very low. During a 2022 monkeypox outbreak, the majority of cases were mild, and the disease was rarely fatal. As of the latest data from that outbreak, there was less than a 0.25% deaths out of thousands of cases. I didn't even know there was a monkeypox outbreak in 2022. So this isn't the first time that the powers have tried to use monkeypox. So let's talk about this 2022 monkeypox outbreak and the unusual circumstances surrounding it. Before 2022, monkeypox cases primarily occurred in Central and West Africa. Most cases were reported in rural areas of the Democratic Republic of the Congo, DRC, Nigeria, and other parts of Central and West Africa. The disease was typically linked to contact with animals, such as rodents and primates. In fact, the only cases outside of Africa involved transmission from an animal imported from Africa. Early cases in the United States and Europe were linked to imported animals or travelers from Africa. This was in the 1970s and 1980s. In June 2003, the U.S. experienced a small outbreak linked to pet prairie dogs that had been in contact with imported animals from Ghana. This was the first significant outbreak of monkeypox in the U.S. and resulted in approximately 47 cases. All cases recovered. Most individuals affected by the 2003 monkeypox outbreak in the U.S. were not hospitalized. The majority experienced mild symptoms and were managed with outpatient care. However, a few cases required hospitalization due to more severe symptoms or complications, but there were no reports of long-term health issues or fatalities. So I find it a bit odd that in 2022, over 87,000 cases were reported worldwide by the end of 2022. The 2022 monkeypox outbreak primarily affected countries outside Africa, which was a first for an infection of this magnitude. The outbreak began in May 2022, with the first cases reported in the United Kingdom. It allegedly spread quickly to Europe, North America, and other regions, leading to widespread concern. A significant proportion of cases were linked to close contact among men in the LGBTQ+ community, particularly gay, bisexual, and other men who have sex with men. Data from health agencies, including the U.S. Centers for Disease Control and Prevention, CDC, and the World Health Organization, WHO, indicated that around 95% of the cases were reported among gay or bisexual men. Estimates of the global percentage of people who identify as gay or bisexual vary, but research suggests that approximately 3% to 10% of the population may identify as LGBTQ+, so the risk to straight individuals of either sex is very low. Now we know that the occurrence of monkeypox outside of Africa is very rare. We also know that less than 0.25% of the infected people died in 2022 and that almost all of the cases resolved without hospitalization. Add to that the fact that nearly 95% of those cases were in gay or bisexual males who had close physical contact. So let's look at the route of transmission to determine one's risk for contracting monkeypox. The most common method of transmission is close contact with the skin lesions, bodily fluids, or respiratory droplets of an infected person. Prolonged face-to-face contact with an infected person is generally required for the virus to spread the virus through respiratory droplets. It can also be transmitted by touching contaminated objects or surfaces, such as bedding, clothing, or utensils. Another way to contact monkeypox is from infected animals, such as rodents or primates, including handling or consuming their meat, can transfer the virus. This, however, will occur primarily in regions where monkeypox is endemic, such as Africa. As of April 22, 2024, the Center for Disease Control, or CDC, published recommendations for the administration of a vaccine for monkeypox cases. They recommend vaccination with a drug called Jynneos under the following conditions. If you had known or suspected exposure to someone with monkeypox or mpox, especially if you had a sex partner in the past 2 weeks who was diagnosed with mpox. They are saying that you should also take the Jynneos vaccine if you are a gay, bisexual, or other man who has sex with men, or a transgender, non-binary, or gender-diverse person who in the past 6 months has had any of the following: a new diagnosis of one or more sexually transmitted diseases such as chlamydia, gonorrhea, or syphilis, or more than one sex partner. You are also advised to take the vaccine if you have had any of the following in the past 6 months. Sex at a commercial sex venue, like a sex club or bathhouse. Sex related to a large commercial event or in a geographic area, city or county for example, where mpox virus transmission is occurring. You have a sex partner with any of the above risks, or if you anticipate experiencing any of these scenarios and you are at risk for occupational exposure to orthopox viruses, such as certain people who work in a laboratory or a healthcare facility. I want to make it clear that while the risk is higher in the LGBTQ+ community, it is still a very mild disease with a less than 1% mortality rate, so don't feel that you must get vaccinated if you are gay or bisexual. Continue to watch and determine if the benefit of the vaccine outweighs the risk. The CDC cautions against mpox vaccination. If you have had a severe anaphylactic reaction to a previous dose of Jynneos, or if you are allergic to the gentamicin, cipirofloxacin, chicken, or egg protein. So let's look at this vaccine a little closer and see what they are going to try to push on us next. During the 2022 monkeypox outbreak, the primary vaccine used was Jynneos, also known as Imvamune or Imvanex in different regions. The Jynneos vaccine was approved by the U.S. Food and Drug Administration, FDA, on September 24, 2019, so it's relatively new. The vaccine was approved for the prevention of both smallpox and monkeypox in adults aged 18 years and older who are at high risk for these diseases. It is the only FDA-approved vaccine for monkeypox. Please pay attention to this. Jynneos is a live, non-replicating vaccine, specifically developed to protect against both smallpox and monkeypox. It is an attenuated vaccine, meaning it contains a weakened form of the virus that is not supposed to replicate in human cells. Jynneos is the preferred and only vaccine specifically approved for monkeypox. ACAM 2000 can also be used for monkeypox, but it has more risks and is generally reserved for specific situations where Jynneos is not available or suitable because it is a live, replicating vaccine, which means that it has not been attenuated to mitigate reproduction. So both vaccines are a live smallpox virus. All people who get repeatedly injected with vaccines should understand this. Common side effects of the Jynneos vaccine include injection site reactions, redness, pain, swelling, fatigue, headache, muscle pain, nausea, chill, and mild fever. On September 29, 2023, the package insert for Jynneos was changed to include the following adverse effects. See if anything sounds familiar. Post-marketing experience has revealed cardiac disorders such as myocarditis, pericarditis, immune system disorders, including hypersensitivity reactions including angioedema, rash, and urticaria. Nervous system disorders including dizziness and syncope, and general disorders and administration site conditions such as injection site warmth and injection site vesicles. By all accounts, Jynneos is the vaccine that will be promoted as the monkeypox vaccine. Now that you know that you may be asked to inject a smallpox virus into your body, let's look at what could happen should you contract a full-blown smallpox infection from it. The symptoms of smallpox are similar to those of monkeypox: fever, fatigue, headache, backache, and sometimes vomiting. A rash begins as flat red spots, which then develop into fluid-filled blisters that become pustules. The rash also typically starts on the face and then spreads to other parts of the body. Smallpox treatment is supportive and includes hydration, pain relief, and management of secondary infections. Vaccinia immune globulin, VIG, and antiviral drugs like cytofovir or tecovirimat may be used in some cases, particularly in severe cases or those with complications. Here's the problem. The fatality rate for smallpox is about 30%, but it varied based on the strain and the health of the individual. The other 70% recover fully, though some may experience scarring or other complications. The World Health Organization declared that smallpox was eradicated globally in 1980, and now they are gearing up a global smallpox vaccine campaign. And if it was eradicated, why did FDA approve a vaccine for it in 2019? Did they know something that we don't know? So please understand this. They are injecting people with a virus that causes death 30% of the time to prevent a viral infection that is fatal in less than 1% of infections. On July 23, 2022, the WHO Director General, Dr. Tedros Adhanom Ghebreyesus, declared the monkeypox outbreak a public health emergency of international concern. This is the WHO's highest level of alert, used for events that require a coordinated international response. On May 11, 2023, the WHO announced that the monkeypox outbreak was no longer considered a public health emergency of international concern. In 2023, some countries, particularly in Europe and North America, reported isolated cases of monkeypox. These cases were generally linked to individuals who had close contact with infected persons or who had traveled to regions where the virus is still present. Travel-related cases have been occasionally reported where individuals traveling from regions with higher incidence rates, such as parts of Africa, brought the virus to other countries. These cases have often been contained quickly through quarantine measures and contact tracing. Yet, on August 14, 2024, once again, WHO Director General Dr. Tedros Adhanom Ghebreyesus has determined that the upsurge of Mpox in the Democratic Republic of the Congo, DRC, and a growing number of countries in Africa constitutes a public health emergency of international concern. So now, all of a sudden, a very rare African disease has all of a sudden become a threat to the world. Tedros believes that the emergence of a new clade of Mpox, its rapid spread, and the reporting of cases in several neighboring countries are very worrying. So a virus that was first discovered in 1958 and has never been a highly virulent, contagious, or dangerous virus has all of a sudden, 67 years later, become an international health threat. Add the fact that it is primarily transferred through gay or bisexual relations. It almost always resolves on its own and is similar to chickenpox. They both have a rash that lasts 2 to 4 weeks, flu-like symptoms, and a good prognosis, with most individuals recovering fully. Unlike chickenpox, Mpox generally involves swollen lymph nodes. I hope that this video has been of some help in your very difficult decision as whether to get the monkeypox vaccine, which is really a smallpox vaccine. Monkeypox is not an aerosolized virus, so it cannot be transmitted by walking past someone or by the air in your car. So please don't start with the masks again because they won't work, and prolonged use of masks can cause serious respiratory infections. I will link the video explaining how at the end of this one. Until next time, don't be a sheep. Don't blindly listen to a talking head on the news. All of your medical providers will be indoctrinated and incentivized to convince you to take the vaccine. Now you have the facts. Confirm the information in this video, and if you are pressured into taking the vaccine, watch this video again before you make your decisions. It could save your life.